A normal shoulder is made up of a ball and socket, as seen here. In reverse shoulder replacement surgery, this relationship is reversed, as seen here. This allows the shoulder to function without rotator cuff tendons. Reverse shoulder replacement is most commonly indicated in the setting of rotator cuff arthritis, where the shoulder has become arthritic from rotator cuff deficiency. It may also be indicated in the setting of previously failed shoulder surgery, such as a failed shoulder replacement, bony deficiency around the shoulder, or severe shoulder fractures. The surgery is done through an incision in the front of the shoulder. The arm is numbed and the patient is sedated. A general anesthetic may be used as well. Most patients spend a day or two in the hospital. The shoulder is initially protected in a special brace that allows healing of the tendons and soft tissues. This brace is worn for about 4 weeks. Use of the arm is allowed immediately after the surgery.